The majority of individuals view blood tests as a simple to-do list. Your physician requests it, you go for the draw, and you await the outcome. However, there's a crucial piece of information often missed. Your actions leading up to that blood draw possess the power to entirely alter those findings. A single error, such as failing to fast correctly, missing a meal, or engaging in exercise just before your test, could result in an incorrect diagnosis or a care plan that isn't appropriate for your system. For the record, I'm Dr. Brian Smith, a board-certified physician in family medicine. In this video, I will guide you through the 10 most frequent errors I observe in patients prior to their blood tests and the alternative actions to ensure your lab results are precise. Now, the very first point is likely the most widespread error I witness patients commit constantly, and it involves failing to fast correctly. Numerous individuals claim they have fasted prior to the lab test or haven't consumed food or beverages for roughly 8 hours. But the reality is they consume coffee just before heading to the lab, or perhaps they have a breath mint, chewing gum, tea, or just lemon in their water. And while each of those items might not appear harmful on its own, this is the fact. Anything possessing flavor, even if it has no calories, is capable of triggering insulin and adrenaline. These beverage additions can distort fasting glucose figures, insulin, and even triglyceride readings. All three are essential for evaluating your metabolic condition. The fix for this is to consume nothing but plain water within the fasting time frame, which is typically around 6 to 8 hours prior to your blood test. Again, I will restate this point due to its high importance. If you are scheduled for lab work and your physician instructs you to fast, consume no food or beverages other than plain water for 6 to 8 hours before the lab work is performed. The second frequent error I observe is failing to take essential medications. If you omit your thyroid medication, antidepressants, or your anti-seizure pills, your lab values can certainly be distorted. Certain medications are designed for daily intake, including the day of your lab test, as they can lead to unwarranted spikes or dips in lab values. This can postpone the findings or the diagnosis and treatment if the lab figures are modified. A case in point is skipping your daily levothyroxine dose, which can artificially decrease your TSH level and create the impression your dosage is incorrect or your thyroid is malfunctioning again. Now, the fix here is to consult your physician before the lab test. Ask, which of my medications should I take on that morning, and which ones are okay to skip? And if you remain uncertain, carry your medication list to the facility where you are having the draw. 9 out of 10 times, the phlebotomist will likely have a solid general understanding of which medications you ought to take that morning and which you should not. The third most widespread error I encounter is getting lab work tested while you are ill, feeling worn out, or simply dealing with inflammation. You might assume a minor cold, an allergy flare-up, or even just one bad night of sleep won't significantly impact the outcome. But the fact is, these conditions can throw your body, particularly your immune system, out of balance. Any of these scenarios can transiently elevate your white blood cell count, ferritin levels, SED rate, and CRP, which are inflammation indicators, and even your blood glucose and cortisol readings. I have personally witnessed patients being incorrectly evaluated for autoimmune conditions when they merely had a cold on the same day their blood was drawn. The solution for this is straightforward. If you are not feeling 100%, are a bit fatigued, or slightly under the weather, move your appointment 5 to 7 days into the future. This allows you to obtain the most precise results achievable. Now, the fourth common error I see, and this one is also quite frequent, is consuming supplements that directly meddle with your lab outcomes. Many people assume it's only a vitamin. This can't possibly harm me, can it? But the fact is, some of the most widely used supplements can profoundly modify your blood test figures. The primary offender here is biotin, often consumed to enhance hair, skin, and nail health. It can markedly disrupt your thyroid indicators like TSH, free T4, and free T3, along with heart markers such as troponin. The astonishing part is that it isn't solely biotin that can distort results. Other popular supplements like ashwagandha or rhodiola can modify cortisol patterns. Consuming excessive vitamin D can impact your calcium levels, and taking too much zinc or copper means they can compete, artificially skewing your iron profile. This can genuinely send clinicians down incorrect pathways, investigating you for conditions you likely do not have. Now, the solution here is to cease all supplement intake 2 to 3 days prior to having the blood test done. Once more, if you are unclear on which supplements to pause, be sure to have that discussion with your physician before the test. If you are on high levels of biotin, over 5,000 micrograms daily, you will need to cease that biotin supplement for a minimum of 72 hours before your labs are drawn. Now, the fifth frequent mistake I notice is one that often goes unnoticed and doesn't receive the level of attention it warrants. This error is failing to be sufficiently hydrated when having your blood drawn. If you fail to drink adequate water, it not only complicates the blood draw process, but can also concentrate your blood, skewing your electrolyte panel. This is particularly crucial for measurements like BUN, creatinine, and hemoglobin. The fix for this is to consume ample water the day prior to the blood test and also on the morning of. Drink roughly 16 ounces of water 20 to 30 minutes before the blood is drawn. This way, the needle stick is simpler and your results will typically be more precise than they would be otherwise. Now, the sixth common error I encounter, and this is one I frequently find amusing because the results can be rather comical when they return, is not informing your doctor about additional prescriptions you might be acquiring online or from a wellness-type clinic. If you are administering testosterone, compounded thyroid, peptides, or even injectable weight loss drugs like semaglutide, these can drastically alter things. But the humorous aspect is that the physician is unaware you are using these substances. Then when they receive results that appear extremely abnormal, it can generate a bit of confusion. And the specific example I am recalling, which has occurred to me multiple times, is ordering blood work for particular individuals. And the results show their hemoglobin or red blood cell count is exceptionally high. When I observe this, I begin to worry slightly. Could they have some form of red blood cell cancer? But the reality is they are simply obtaining exogenous testosterone from an online source, and doing so can elevate the red blood cell count. That rise in red blood cells is concerning, but a brief conversation brings us to the solution. Now, the primary takeaway from this is to ensure you reveal this information to your physician. It can spare both you and your doctor a significant headache. So a solution is to reveal all your medications and supplements to your doctor, even if you presume they are not highly pertinent. The seventh common error I see, which I often find in my more health-aware or physically active patients, is working out on the morning of, before the blood draw. Exercising can temporarily elevate creatinine and creatine kinase, which might resemble muscle injury or kidney problems. It can also raise liver enzymes, especially, as well as glucose and/or cortisol, potentially mimicking diabetes. The solution for this is, naturally, to refrain from strenuous exercise before you have your blood drawn. Now, a light stroll in the morning, if that is something you like to do, will be perfectly fine. But absolutely do not perform that HIIT session. Postpone it until after the blood test is complete. Mistake number 8 that I observe involves patients consuming substantial, fattier meals about 12 to 18 hours before their blood work is done. Even if you adhere to the 6 to 8 hour fasting period, eating a dinner high in fat the previous night can elevate cholesterol and your triglyceride readings, which can substantially distort lipid profile results. This is particularly vital for people who have a higher cardiovascular risk, metabolic syndrome, or PCOS. The solution here is, the night prior, to consume a meal or dinner that is somewhat blander. It can be higher in protein with a reasonable amount of carbohydrates, but aim to avoid high-fat food items. The ninth most common error I find is having blood work performed too quickly following a change in medication. I see this again in my patients who are highly proactive regarding their health, which is commendable. But if you've only just begun your new thyroid medication or recently started a statin, and you're eager to see how your thyroid or cholesterol panel has shifted, you truly must allow about 6 to 8 weeks before expecting to see those results show any significant difference. If you test too early, your system may not have had sufficient time to adapt to the new medication. This could present a false picture that the drug isn't achieving as much as it should, when it is actually performing quite effectively. Now, the solution for this is to ask your physician, how long must I wait before rechecking these labs? Again, for many things, it is around 6 to 8 weeks, perhaps slightly more, but absolutely have that discussion. And the 10th and final mistake I see patients commonly make is scheduling their blood draw for the day immediately before their next doctor's visit. And so, while I commend you for actually getting the blood work done, as not everyone follows through, if you do it too close to the appointment, then your doctor lacks the time to review those results. And if we lack the actual data, we cannot assist you in the best manner we otherwise could. The solution for this is to book your blood work for at least 5 to 7 days prior to your upcoming doctor's visit. This ensures that if a specific blood test requires 2 to 3 days to come back, your doctor will possess all of those results before you arrive and will have time not only to review them, but also to discuss them with you during the appointment. All right, so as a brief review, I'm going to give a rapid-fire list of the 10 most common mistakes, starting with number 1, which is drinking water only. That is the sole method for true fasting. Consume only your essential medications. Reschedule your labs if you are feeling unwell or worn out. Pause supplements that interfere with these labs, particularly biotin. Remain hydrated. Disclose all online prescriptions or wellness clinic medications. No strenuous exercise on the morning of. Keep your dinner light the evening before. Allow 6 to 8 weeks after a medication change before retesting your blood work. And schedule your labs a minimum of 5 to 7 days before your visit. If you cannot recall all 10 of these items, do not be concerned. I have created a PDF that covers everything we talked about today, and you can access that PDF entirely for free at the link down below. That PDF is a great tool, but I want to leave you with a larger concept that ties all of this together. The core lesson from these 10 mistakes isn't just about biotin or fasting. It's about recognizing that you are an active partner in your own healthcare, not a passive passenger. For decades, the old model of medicine was very paternalistic. You were told to just do what the doctor says. We'd show up, get poked, and wait for a call saying everything's fine or you need this pill. But as we've just discussed, how you show up matters. Modern effective healthcare is a partnership. Your blood work is the raw data, the primary evidence that your physician uses to make critical decisions about your life. Think of it this way: garbage in, garbage out. This is a concept from computer science, but it applies perfectly to medicine. If you provide your doctor with garbage data skewed by a morning workout, a biotin supplement, or a cup of coffee, you will get a garbage output. This isn't just an inconvenience. It has real-world consequences. I have seen patients whose TSH was artificially suppressed by biotin, leading to a doctor incorrectly lowering their thyroid medication, which caused them to suffer weeks of fatigue and brain fog. I've seen creatinine spike from exercise, triggering an unnecessary and expensive referral to a kidney specialist, causing immense anxiety. Your diligence before the draw prevents this. It's the highest leverage, simplest thing you can do to ensure your treatment plan is actually built for you. Every single mistake we covered highlights a profound biological truth. Your body is a deeply interconnected system. You cannot just isolate one part for a test. What you ate last night is the fat in your bloodstream this morning. A hard workout isn't just in your muscles. It's a systemic event reflected in your kidney and inflammation markers. Even a poor night's sleep can alter your cortisol and blood sugar. This isn't a flaw, it's the elegant design of your biology. And understanding this design is the first step toward true wellness. It teaches you that your daily choices, what you eat, how you move, how you sleep, what you supplement, are constantly writing the story of your health. The blood test is just the day we read that story. This leads to the next crucial takeaway. A single lab test is just a snapshot in time. It's one frame from a very long movie. Our goal in medicine isn't to just pass the test on one specific day. Our goal is to understand the trends. Is your A1C trending up over 2 years? Is your vitamin D level finally rising after supplementation? Is your cholesterol slowly creeping down after a diet change? This is where the real wisdom lies. By avoiding these 10 common errors, you're not cheating the test. You are ensuring that the snapshot we take today is a true and honest representation of your body's current state, so we can compare it accurately to your last snapshot and your next one. Consistency is what allows us to see the pattern. The ultimate lesson here is one of empowerment. It's easy to feel like our health is something that just happens to us. But these simple actions, hydrating, pausing a supplement, scheduling properly, and being honest about all your medications, are all small acts of control. You are taking charge of the data. You are ensuring the story your biology tells is accurate. This proactive mindset is, in my clinical experience, the single greatest predictor of long-term health. It changes the entire dynamic of your doctor's visit. Instead of spending the appointment trying to figure out if a weird result is real or just an error, you can have a high-level conversation about what to do next. It's the mindset that moves a patient from simply managing disease to actively building health. Your health journey deserves an accurate starting line, and your treatment plan deserves a solid foundation. Following these steps ensures you get both. Finally, let the wise listen and add to their learning, and let the discerning get guidance. This is from the book of Proverbs 1:5. This is Dr. Smith, and I will see you all in the next one.